Hi guys, so these are your flipped notes on the pectoralis muscles and the abdominal muscles. So you're going to want to use page 67 and 68 of your notebook to record them. And so remember, for each of the muscles that we learn, we are going to learn what the origin, insertion, and action is in the human, and you guys will see pictures to identify those muscles. But then we also want you guys to be able to identify them in the cat as well. And so we're going to go through everything that is expected of you that you should know as we go through these notes. So we're first going to talk about the pectoral muscles. And so these are the muscles that make up your upper chest. So the first one is the pec major. And if you look at this picture here, this whole thing right here is the pec major. So remember, origination is where the muscle originates from. And so it's where the muscle starts. We can see that the origination of pec major is the clavicle, sternum, and costal cartilage. So what it's talking about is here's our clavicle, there's our sternum, and then there's the costal cartilage where it all originates from. So that's where the muscle is starting. The insertion of pec major is into the bicipital groove on the humerus. So remember, we learned about all of those bone markings last semester when we studied the skeletal system. This is where they're really going to come back into play. And so we can see here that all of this muscle is inserting on one spot on our humerus known as the bicipital groove. There are three actions that when the pec major contracts, it is going to produce motion. It is going to adduct the humerus towards the front. It flexes the humerus, and it also rotates the humerus. So we're going to look at those in more detail now. So here is the adduction of the humerus. So we can see that it's getting added back towards the midline, like we've talked about. Here is the example of it flexing the humerus, because remember, when the action is flexion, it's decreasing the angle. And so we can see that it's starting down at the side and the angle is getting smaller. And here's an example of when it contracts, how it can rotate the humerus towards the body. So when it contracts, it brings that humerus back and rotates it in. So remember, we're going to want you to identify them in the cats as well. And so there is a couple muscles in the cats that are not found in humans because they are quadrupeds and we're bipeds. So since they walk on all fours, there's a couple differences in the muscles that they have that we don't. So if you see here on the top, that's a muscle that the cats have that we don't. You guys won't have to know that one, but it's called the pecto antebrachialis. And so pec major sits underneath right here in the cats. And so it sits right underneath this pecto antebrachialis. And when you guys look at the cats in person, the way that you're going to be able to tell one muscle from the next is because you're going to see the direction of the muscle fibers change. So the pec major in the cats will see the muscle fibers run in one direction compared to the pecto antebrachialis running in a slightly different direction. The next pec muscle that we are going to want you to know is pec minor. So you guys can see it's this muscle right here. So it lies underneath pec major, as you can see. The origin of pec major is the sternal end of the ribs 3 and 5. So we can see 3 through 5. So we can see it's originating from ribs 3, 4, and 5. It inserts on the coracoid process of the scapula. So that's what that's showing you here. So remember, the scapula is on our backside, but there are some different processes that come more towards the front. And so that's what we're seeing here is that coracoid process of the scapula where it inserts. And then when it contracts, it draws the scapula forward and downward. So when those muscle fibers shorten, we're going to see the scapula come forward and downward. And this is the motion of the pec minor on the scapula. So we can see it comes forward and down when that muscle contracts. Good. And pec minor in cats looks a little bit different than it does in humans. So this whole thing, so from this edge to this edge is pec minor, because here again is our pec major. And then there's the pectoralis minor in the cats. So the reason it's called pec major is, well, one, when we were originally studying muscles, we were studying them in humans, and pec major was a lot bigger and it was more on the surface compared to pec minor. And so the way that I remember the order when I look at the cats is pec major is more superior and pec minor is more inferior. So it just helps to orient yourself based on the names. In your notebook on page 66, you guys will see an OIA for the pecto antebrachialis and the xiphi humerales. You do not need to know those because they are only in cats, so we are not expecting you guys to know the OIA of those muscles since we don't have them and we focus on human anatomy in this class, and we are using the cats to be able to compare and identify the muscles that are similar between us and them. So just cross those out. You won't need to know them. Which means that we are going to move on to the abdominal muscles. So these are the muscles that make up the lower portion of our trunk or torso. The overall actions of the abdominal muscles include to be able to flex the trunk, so like bending at the waist and coming forward, to rotate the trunk, so rotating side to side, and then also to increase intra-abdominal pressure. So they help keep all of the stuff inside of our belly nice and tight and in place. So we're going to talk through the 4 abdominal muscles that we would like you to know. The first one is the rectus abdominis. So we can see the location is immediately lateral to the midline of the body on the abdominal surface. So I need to talk about one structure before we get into all of this because it's going to be referenced several times throughout all of the muscles of the abdomen that we're going to look at. So one of the main structures in our abdomen is called the linea alba. So this is a band of connective tissue that runs down the midline of our abdominal muscles. So it's this entire thing. And so the rectus abdominis lies on both sides. It resides on the left and the right side. So it's all of this and all of that. And so when we look at the rectus abdominis, it originates from the pubic crest and symphysis pubis. So it's originating from our parts of our hip bones. So it's originating from down here. And then it inserts, because we can see it runs a very large portion of our abdomen, it inserts at the costal cartilage of ribs 5 and 7, the xiphoid process, and the sternum. So it also then inserts up here is what it's talking about. And its action is to flex the torso and compress the abdomen. So if you guys ever, like the 6-pack abs, those are coming from definition of the rectus abdominis. So you guys can see that structure that's there. We all have them, you know, sometimes we just don't always get to see them, but the 6-pack abs are coming from the definition of the rectus abdominis. And so here's that flexion of the trunk that we were talking about. So when it contracts, because it originates down here and then inserts up here through the ribs and the sternum and the xiphoid process, when it contracts, it's going to bring everything closer together. So that's what flexion at the trunk looks like. Because remember, flexion is decreasing the angle. And so you guys can see we're decreasing the angle between our torso and lower limb. The next set of abdominal muscles that you guys are going to know is the external oblique. Oh, I should back up. So the reason that I don't have a picture of the rectus abdominis in the cats is because a lot of times we don't, as we skin the cats, that's a muscle that is really hard to keep attached to the cats. And so We can see parts of it, but it's a little bit harder to see in the cats. It's there, but we'll focus on identifying the external, internal, and transverse muscles in the cats. So here's our external oblique in humans. So it's the abdominal muscles that run down and on the side. They are the most superficial of the abdominal muscles that are on our sides. So they originate from the external surfaces of ribs 5 through 12. And then they insert on the iliac crest and the linea alba. So you guys can see that they'll run down and in. And so they insert here on our linea alba, as well as the iliac crest of our pubic bone. The action of the external obliques, it also flexes the vertebral column, it rotates the vertebral column, and it laterally flexes the vertebral column. So let's look at what all of those actions actually mean. So there's our flexion of the torso that we saw before. So the external obliques also assist with the rectus abdominis to produce that motion. This is the rotation that we were talking about. So as the if I start this way and I want to rotate, my external oblique is going to be the main muscle that helps me rotate my torso. And this is the lateral flexion that we were talking about. So if you guys, my biggest piece of advice when you guys are learning this is do the movements yourself. Feel your muscle contracting as you do these movements. Because if I go down and I want to reach back up towards the top, the external oblique is the one that's assisting me in that motion. And so you guys use your body to study. Think about where this muscle is, do the motion and feel it, because that's really going to help you do better in this unit. So here, that's the lateral flexion that we were talking about for the action. And this is the external oblique here in the cats. The next one sits deeper inside of our torso. So it sits underneath the external oblique, and it's called the internal oblique. And so it originates from the iliac crest. It inserts on the costal cartilage of the ribs 8 through 12. So it's this one right here. And so we can see where it's inserting on that costal cartilage of the ribs, as well as then it's also going to insert on the linea alba. It does similar motions as the external oblique. It flexes the vertebral column, it rotates it, and then it also laterally flexes the vertebral column. So here's a nice GIF showing you guys all of the motions that we just talked about. So there's the lateral flexion. So this is the internal oblique that's highlighted here. There's that rotation that we were talking about. And then again, it's that what's not shown is that flexion forward at the hips. And so my little thing is in the way, so I'll move it for a second. Here's that internal oblique to give you guys an idea about where it is. And so there's our insertion that we talked about, and there's our origination. And when you guys look at it inside the cats, we have to dissect away the external oblique. And this takes a lot of patience because these are very thin and delicate muscles. And so here's the internal oblique. And what's cool when you guys start to look at these in the cats is you'll actually see the muscle fibers run in opposite directions. So it's giving that support to our abdominal cavity. So we have the external obliques fibers that run more down and in. And I know it's hard to see in this picture, but here on the internal oblique, the fibers run more up in the opposite direction, kind of making a cross. And so what you guys are seeing here is that we've dissected away this external oblique so that we can see the internal. And last is the transverse abdominis. And so this originates from the iliac crest. And the cartilages of ribs 6 through 12, and it inserts on the linea alba, the xiphoid process, and the pubic symphysis. And so the main function of the transverse abdominis is to compress the abdomen. So when we originally talked about the overall function of the abdominal muscles, we said it was to increase internal abdominal pressure. The transverse abdominis really helps with that. And so now we've dissected away in the cat the internal oblique, and the furthest inside, the last muscle before you get into the digestive system, so into the intestines, is the transverse abdominis. And it really changes in color because we can see these white fibers running through the transverse abdominis. And again, we see it's running a little bit more horizontally. And you guys will see that the angle of the transverse abdominis is different than what we saw. The angle that the muscle fibers run is different than what we saw in the external oblique and the internal. And so you guys will have to be very careful. You can see, even just from these pictures, how thin these muscles are. And so, because if you puncture and cut through all of the muscles, you're going to be into the large and small intestines, which is not what we want. So make sure as you guys dissect the cats that you take time and be patient with yourself when you get to this section, because it's thin and we don't want you to open up the abdominal cavity too early. So there's the end of our notes. Make sure you guys study those OIAs because it's a ton of terminology. Use your body to understand the actions and where they're at to help you remember which one's which. And let us know if you have any questions.